Hello everybody, my name is Manuel Maia. I am a medical oncologist from Brazil, and right now I'm a GU Oncology Fellow from City of Hope in California. And I would like to present to you some results that were presented yesterday by Dr. Bernard Scudier in the plenary session here at ESMO 2017 in Madrid. So this is a very important study, Checkmate 214, comparing nivolumab with ipilimumab against sunitinib in kidney cancer patients with metastatic disease. So this was a very large trial with more than 1,000 patients enrolled worldwide, and so the combination was compared against sunitinib. The combination was given with 3 milligrams per kilogram of nivolumab and 1 milligram per kilogram of ipilimumab every 3 weeks until 4 cycles. Then nivolumab was given every 2 weeks until progression, compared to sunitinib given in 50 milligrams daily for 4 weeks with 2 weeks off. So this study had 3 co-primary endpoints, which was overall response rate, overall survival, and PFS. A secondary analysis was done including favorable risk patients. The 3 co-primary endpoints that I mentioned before was only in intermediate and poor risk patients, and the intention to treat analysis, which was the secondary endpoint, included also favorable risk patients with MRCC, and also some exploratory analyses regarding PFS and overall survival in PD-L1 positive and negative patients. So the overall response rate was statistically significantly improved with the combination. It was around 42% against 26%. So it was very, very impressive. Also, the PFS, although it was clinically relevant because it almost reached 12 months mark, was still not statistically significant. So the PFS was almost 12 months with the IO combination compared to 8.5 months with sunitinib. However, I assume this was not significant just because they had to split the p-value between the 3 co-primary endpoints. That's how I understand this trial. And most importantly, the overall survival was improved with this combination, which the median overall survival not being reached yet against 26 months with sunitinib alone. So this was the 3 co-primary endpoints, which included, as I said, only intermediate and poor risk patients. And the intention to treat analysis, which was the secondary endpoint, also included favorable risk patients. Taking all patients together, there was still a meaningful improvement in overall response rate and overall survival. However, subgroup analysis exploring the benefit among the favorable risk group patient alone did not show a difference, and actually the IO combination did worse compared to sunitinib among this subgroup. So this is very important for us, since we have to assume that this combination might not be ideal for favorable risk patients and should be reserved at this time for patients with intermediate and poor risk. And exploratory endpoints were reported as well. PFS, overall survival in PD-L1 positive and negative patients, and as reported by the authors, PD-L1 positive enriched this population to derive a greater benefit with the combination. However, PD-L1 negative patients also benefit from the combination, although there was not a statistically significant difference between sunitinib and checkpoint inhibition in this setting. So to summarize, this is a very important trial. I reported that it's changing the paradigm in the first-line treatment of metastatic RCC patients. So I assume this is one of the first options we have right now. Although, as I said, we should be focusing in intermediate and poor risk patients. For favorable risk patients, it might not be a change right now. However, we have to acknowledge the fact that other trials are still ongoing, and although some trials have already reported some important results, like Cabo-Sun, showing significant improvement in PFS in the same population. So checkpoint inhibitors for first line is certainly an option from now on. However, other options may still apply. So I will also like to promote here an event we are doing in my center, in my institution, which is going to take place at City of Hope in December 15th of this year. It's an international GU oncology, and we will have some worldwide renowned oncologists there, like Fabio Schutz and my mentor, Samantha Paul. and we would like to invite you all to join us for this meeting. We are all invited. Thank you very much.